Okay, Dr. Ulysses Jackson. We're going to pick up today with what is a differential? What's a differential diagnosis? This is something that if you're not in the field, this is nothing that you would go look for, But it's so important and so prevalent to the field that you understand and know what a differential is. The best I could explain it is you have a cough, you have a sneeze, you're sneezing. You go to the doctor. It's evident that you have a cough and you're sneezing. Is it fair to say you have the flu or emphysema? No, he has to do further investigation, to find out what you have. So sometimes for those novice mental health practitioners or those that would pursue to be, go into, you got a cold, you got the flu. Very unfair. So what is a differential diagnosis? A differential diagnosis is almost like saying it looks like, but it isn't. So let's go into this. Please go to a mental health professional when you want an accurate diagnosis, because we're going to be held accountable because we have a license in the field, and we have sometimes our soulmates, our lovers, our friends, our sisters, our brothers, our children. We want to you have. And like I said in another video, if you see somebody that needs a brake job and you saw the mechanic fix the brakes, why don't you just go and say, I can fix the brakes? You know why you don't? That's not something you want to do. So let's stop giving these diagnoses. Or if so, go to the DSM-5 and read it up and come up with the features. And if you do that, that does not make you a mental health counselor. That broadens your knowledge and your scope of what's going on, what it is or what it isn't. So I'm going to give y'all an example real quick of what a differential is. I'm going to go from the book. I'm going to use acute stress. This is what acute stress is. Exposure to an actual or threatened death or serious injury or sexual violence. PTSD holds that same criteria in the beginning, but it goes on, it's further. It said the person must directly experience the traumatic event. This is acute stress now. Witnessing this event as it also occurred maybe to others. The person could learn that this has happened to a close friend or a family member. In cases of death and physical injury. Experiences is repeated exposure to a traumatic event. This does not apply through social media and television. So you can say, I have acute stress and PTSD. They mimic themselves. But this is where it starts to get real interesting. Is that when you look at some of these differentials of what is associated with that, the differential to acute stress is misdiagnosed post-traumatic stress disorder, an adjustment disorder, a panic disorder, a bipolar disorder, a panic disorder, a psychotic disorder, dissociative disorder, OCD disorder, or even a traumatic brain injury. So look at this right here. The differentials for acute stress could be what? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 different things that have the same feature. I and my cohorts and other licensed practitioners got to get it right. We can't guess. You, the public, could take your loved ones and guess. Hey, I have this or I have that. We can't. So this is Dr. Ulysses Jackson breaking down what a differential is. It's something that mimics something, but it's similar to, but it's different. So let's stop misdiagnosing each other. Let's educate each other. Hey, go back to the video. Go back to YouTube. Listen to me. Listen to someone else to figure this out, because we're in a day and time when violence, sexual violence, gun crimes, it's at an all-time high. Regressive trauma, things that happened when we were young or resurfacing. And they're saying, go talk to someone. Make sure when you're talking to someone that you're doing yourself more good than more harm. This is Dr. Ulysses Jackson, and we just touched on part 1 of what a differential diagnosis was. Catch me on this next part on Instagram, Facebook, and Twitter, and TikTok to just keep this thing going on what mental health. And drop a line, drop a comment. You know what I'm saying? Talk to me. You know what I'm saying? Let me know what you feel about it. You know what I'm saying? I don't want this to be a lecture. I want this to be educational. And I'm giving it up because I studied too hard for this to sit here and watch, people misdiagnose each other. Dr. Ulysses Jackson, PhD, diagnosis of differentials.